Before you begin fertility treatments, you'll come in for an initial consultation with Dr. Jeff Nelson and the staff. And today, Jermaine Underbrink, who's a registered nurse and an IVF coordinator with Dr. Nelson's team, is going to be telling us a little bit more about the staff and what that first visit will be like. It's good to see you, Jermaine.
Nice to see you too.
Thank you. Now let's start by having you tell us a little bit about your role as an RN and IVF coordinator with the patients and what a typical day is like for you at HRC Fertility Pasadena.
Well, when we come in the morning, usually we'll kind of evaluate our day with Dr. Nelson. We'll look at the schedule and kind of plan things out. Most of the morning hours are spent with our cycling patients or ones who are actually in treatment. And the afternoons are usually spent with follow-ups and new patient consultations.
And Jermaine, can you tell me a little bit more about the team that you work with on a daily basis?
Well, my immediate team is consisted of two other IVF coordinators, Jolene, who actually speaks Mandarin, and also another clinical coordinator by the name of Justina, who also speaks, I think, 3 different languages, including Mandarin. And the last person is Adeline, and she's also an IVF and clinical coordinator who deals with most of our third-party cases for egg donation and surrogacy.
And you all work very closely with the patients?
Yes, we do. So that's my immediate team, but of course, our team of HRC broadens into the Pasadena site, which includes, our lab, our embryologists, our front staff, our back staff, and all the doctors as well.
Jermaine, can you walk us through what a typical first consultation is like with Dr. Nelson so patients know what to expect when they come in?
Certainly. So most patients will come in and check in our front office area into the lobby. They'll be taken back to meet with Dr. Nelson for about half hour, 45 minutes. He'll be meeting with them and discussing their history and taking some notes. And then we'll go ahead and bring the patient back for a transvaginal ultrasound. We'll be looking at their ovaries and their uterus and kind of getting a baseline point for them. After that, I'll usually meet with the patient and we'll go through the plan that Dr. Nelson has set for them as far as treatment, talk about any diagnostic testing they might need to get done, lab work, and things of that nature.
And how long does the first visit typically last?
Usually it's about an hour. It depends on the patient's, history and such, but Dr. Nelson will usually spend about 30 to 45 minutes with them talking about their history. And then, the ultrasound will take about 15 minutes and about 15 minutes with me. So anywhere from an hour to an hour and a half.
Jermaine, you mentioned an ultrasound and screenings. Can you elaborate a little more on what a patient might need as far as testing goes during the whole treatment process?
Definitely. Obviously, we're going to get kind of a baseline ultrasound, a transvaginal ultrasound that we're going to do at the new patient consultation. But going forward from that, usually the patient will contact us on day 1 of the bleed or the menses they're ready to get started with. And we'll almost always do what's called an ovarian assessment report, which is a simple blood test that looks at 5 different hormones to really evaluate how the patient's ovaries are doing. Sometimes we have a 20-year-old who'll come in and her ovaries are acting like a 40-year-old, but we don't know that just necessarily from looking at the ultrasound. The hormone test is really going to give us more information. We'll also, at the ultrasounds that we'll do, we'll get what's called an antral follicle count, and sometimes that will give us a little more information. It's resting follicle count. So before we start medication, really how many follicles or containers of the eggs are we looking at upon the ovaries in doing the ultrasound. Next, as far as diagnostic testing, we're going to be doing an evaluation of the uterus. And usually there's 2 main tests that we'll do depending which route of treatment the patient is going to take. For inseminations or IUIs, we're normally doing what's called an HSG or a hysterosalpingogram, which is actually an x-ray test that's done over at the hospital. A lot of times Dr. Nelson will accompany the patient over at the hospital and do that test with them. And basically it's a simple dye that's put through the tubes in the uterus and kind of gives an outline of how things are looking. And that's a really effective test to look at the tubes, the fallopian tubes, more than the uterus, so to speak. The second test that we'll do more for our IVF patients is called a sauna histogram or a water test. And that's a simple test that's done here in the office. Dr. Nelson will take a sterile catheter just through existing openings, put some sterile water inside the uterus. The uterus is a closed cavity, so the sterile water will go ahead and open up the cavity while Dr. Nelson has the transvaginal ultrasound inside. So water on ultrasound is actually dark, so when the uterine cavity opens up, we can see if that lining is clear and free of any scar tissue or polyps or overgrowths of the lining. We want to make sure that the uterus looks absolutely fantastic before we're going to be moving forward with treatment, whether it's insemination or IVF. Some of the other tests that we do would be infectious disease screenings. By California state law, we need to make sure that certain tests are done for both patient and partner, such as HIV, hepatitis, syphilis, etc. Those are simple blood panels that we can draw here for the patient, or they can take to their outside doctor with lab slips that we'll give them on new patient consultation. Really the last portion of treatment would be, of course, the semen analysis. And that's something simple that a partner can come in and do here. We have special rooms dedicated just for that process. And it's a simple test that's done. We usually get results in about 24 hours. And of course, if a patient is considering using donor sperm, we'll recommend them to certain cryobanks in the area that we work with.
Jermaine, if a patient needs to take any medications or needs injections of any sort, will there be training by the staff so they know what to do?
Definitely. I know a lot of patients come in and they're very apprehensive about doing the injections, but we assure them that they're very small injections, the size that diabetics do for insulin. So they're very small, and it's a very short window of injections that what they'll be doing. But we make sure that we set aside extra time so when they come in, we have a little demonstration